Wet hands with water. Apply enough soap to cover hands surface. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational backwards and forwards, clasp fingers of right hand in left palm and vice versa. Rub wrist back and forth and vice versa. Rinse with water. Dry hands. Thoroughly with towel. Use towel to turn off the tap faucet. Sequence for donning personal protective equipment or PPE. Gown. Fully cover torso from neck to knees. Arms to end of wrist. Fasten in back of neck. And waist. Mask. Secure ties or elastic bands at middle of head and neck. Fit flexible band to nose bridge. Fit snug to face and below chin. Fit check respirator. Gloves. Extend to cover wrist of isolation gown. When taking vital signs, knock on the door and introduce yourself to the patient. Prepare all the equipment needed and ensure the patient that he or she is in good hands. Help the clients to assume a position of comfort for auxiliary to promote relaxation. Prepare the thermometer out of its holder. Cleanse the thermometer from body to bulb. Turn on the thermometer. and place it on the armpit. While waiting for the result, place the oximeter on index finger on either hand. Next, place fingertips of index and middle finger on the surface of wrist. And take note of patient's inspiration and expiration without their knowledge that you're counting respiration to avoid controlled breathing. Count for 1 full minute. Don't forget to take note all the results and inform your patient about their temperature, respiratory rate, and pulse rate, together with her oxygen in the body. In taking the blood pressure, assist the patient and assume a correct position that promotes patient's comfort and relaxation. Place the cuff approximately 1 to 2 inches above the inner aspects of the elbow. Arrange the manometer gauge at eye level. This is to ensure an accurate reading palpate of the brachial artery or radial pulse. Extend the arms through the palm facing upward. Note the point of the gauge at which there is an appearance to the first faint but clear sound, which slowly increases in intensity. Note this number as a systolic pressure. Read the pressure to the closest even number. Lastly, wish your patient well. Sequence for removing PPE or personal protective equipment. Gloves. Outside of gloves is contaminated. Grasp outside of glove with opposite hand. Peel off. Hold removed glove in gloved hand. Slide fingers of ungloved hand and the remaining glove at wrist. Peel off over first glove. Discard gloves in waste container. Gown. Front and sleeves are contaminated. Unfasten ties. Pull away from neck and shoulders, touching inside of gown only. Turn gown inside out. Fold or roll into a bundle and discard. Mask. Front of mask is contaminated. Grasp bottom ties, then top ties, and remove. Discard in waste container. Wet hands with water. Apply enough soap to cover hands surface. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational backwards and forwards, clasp fingers of right hand in left palm and vice versa. Rub wrist back and forth and vice versa. Rinse with water. Dry hands. Thoroughly with towel. Use towel to turn off the tap faucet.